Confidentiality versus public safety. Confidentiality means keeping someone's secret. Public safety means protecting people from harm. Most of the time, they're fine together. But when a secret puts life at risk, which duty wins? That's what we're talking about today. Let's talk about a real ethical dilemma doctors face today. You're a doctor in a public hospital in Manila. If patients admits they have a contagious disease, one that spreads quickly and can kill, they beg you not to tell anyone. It will ruin my reputation, they say. Do you break confidentiality and warn the public? Or do you respect your patient's privacy? This isn't hypothetical. It's happening in the Philippines right now.
Here's the setup. In the Philippines, physician-patient privilege is protected by law. The Rules of Court, Section 24C, Rule 133 says a doctor cannot be forced to testify about a patient's condition without the patient's consent. The Data Privacy Act of 2012 also protects medical information. Why? Because without confidentiality, patients wouldn't be honest. A person with HIV might hide their status. A drug user might avoid treatment. Trust would collapse. So, that's why, here's the problem. What happens when keeping a secret puts other people at risk?
Let me give you a real situation happening right now in the Philippines. The Department of Health has reported rising cases of drug-resistant strain of tuberculosis or XDR-TB. It spreads through the air, it's difficult to treat, and it can be fatal. Now, imagine a doctor discovers a patient with XDR-TB. The patient is a jeepney driver. They carry dozens of passengers every day. The patient refuses to stop working. They say, I have a family to feed. I can't afford to take time off. What does the doctor do? Under the law, breaking confidentiality could mean legal trouble, but not breaking it could mean infecting dozens of people, including children, elderly, and pregnant women.
So how does a doctor in the Philippines think through this? First, duty-based ethics. The doctors swore the Hippocratic Oath. Part of that oath is confidentiality. The Philippines Medical Association Code Ethics says a physician shall respect patient privacy. Breaking that premise undermines trust in the entire medical profession. If patients know doctors might report them, they lie or avoid treatment altogether. Second, utilitarianism. This says prevent the greatest harm. Save